follow-up video 2 days post-op my dental extraction on Friday. It is now Sunday. The hematoma bruising has really begun surfacing. It started surfacing some the night of, and I have been icing it. I have a clay pack that I use that I put on in intervals, but it's still bruised anyway, and I take 2,000 milligrams of an anti-inflammatory every day. Right in here it's actually very firm, very hard, and then inside I have a little bit of bruising right in there. Ow. And then the roof of my mouth, there's quite a bit because when she did the injections at my palate, the dentist, you know, got the job done, but she was very, what's the right word to use here? You were very much a procedure sitting in her chair and was very mechanical about the whole thing and wanted to get it done as quickly as possible. So nothing like having a needle rammed up your palate without any warning at all. So why I had some anxiety. Anyway, I had hoped that having this tooth out after being one, told it wasn't infected, and then two, finding out it was infected, that it would bring some relief, and it hasn't, which is concerning to me. I know it's only been 2 days, so I'm not talking about the soreness from the extraction itself. That is to be expected. But the trigeminal neuralgia nerve pain that I was having is still very present. I'm not having the spasm episodes that I was prior to the extraction, so that is hope, giving me some hope. But today, especially back in here, it's much more pronounced. Yesterday I noticed it was still there, but today it's actually hurting more to where I can barely touch again, and it's going up here. I'm having the numbness still in here, and it kind of bothers my sinus area in here. Still no discharge or congestion. And then numbness, I'm still having numbness. And this morning after I got up, I slept more today. My body's still very tired. I'm still very sleepy. I can't even feel the tooth in front of the tooth that was extracted at all. So that numbness was starting before I had this extraction done across my upper jaw and in here in my face. So I'm concerned at this point if it's possible that the infection is in my nerve. She increased the antibiotics to 4 a day, which I have been taking since Friday, and I'm not having an increase of feeling better at all in any way. I'm still incredibly sleepy. I'm not as easily agitated as I was, so that part of, you know, the infection being out is helping. I still throb when I bend over to pick something up or, you know, pet my dog, anything like that. So I know I have blood sitting in my face. So I'm a very intellectual person, if you haven't picked that up by now. I do have common sense. I do weigh a lot of things out and apply it, and then sometimes I will amaze myself and overlook something that should be blatant and it's just not. So I'm still weighing things out, but I am quite concerned, and there's still pressure in here. So I am concerned that there is an infection in my nerve, which the antibiotics should have cleared up by now if they're not strong enough. From what I've read, people with a real, you know, true nerve infection have to actually be hospitalized and put on IV antibiotics. That's what I wanted to point out. I was thinking about this morning in bed. I never had redness or swelling or bleeding around the tooth that was infected, just a heads up. There was no obvious sign that there was something going on other than pain in my face. There was no abscess ever reported in any of the two different doctors did x-rays. They didn't see an abscess. But even before I went to the emergency room, there was no abscess at the top of my gums or jaw, whatever. But there was zero redness, no swelling, no bleeding at all around the tooth. So I looked up a lot of stuff on Google for symptoms, and that's one of the things that symptom. I've also not run a fever. My body temperature has been on the lower side, which I see is normal for someone. If they do have an infection, it can be high or lower. So I had a lower body temperature, but I didn't run a high fever. So I will be following up with the dentist tomorrow. I had already had a post-op appointment scheduled with her for the 24th, but I'll be calling them back tomorrow. She was great as far as being patient with me in my response to her impatience with doing the procedure. And, you know, they comforted me at the end and gave me a hug. I won't let her do any further oral surgery on me. I mean, look what happened. I'll give her a good review because she did the job and she was, you know, kind and stuff. But as far as her mechanical, you know, in and out, that bedside manner wasn't something that I needed. This is why people have traumas when they go to the dentist, is experiences like this, and I already came in shell-shocked from stuff like this before, so it's awesome. I went hoping for relief, and I actually have a whole nother problem that I didn't have before I went in now, or just it's added on top of what I have. I will also be following up with my medical doctor on Monday as well. I did stop the anti-seizure medication because I had only taken it for 2 nights before having this, and the first dentist I saw said if the tooth is infected to stop taking it, because that would rule out. But she also did say if it does not bring relief, then start the medication. So and in Google searching this morning, if there is a nerve infection, they do prescribe anti-seizures medication. So it looks like I'll be taking that regardless, which is probably not a bad thing. I have other nerve stuff. Sciatica usually bothers me. The one thing I didn't like about this medicine, I had mentioned it gives me sleep disturbances, which it does. I don't sleep soundly at night. I toss and turn a lot, vivid dreams. But what I noticed is when I take it, it actually heightens nerve pain for me. Parts of me that don't really normally bother me, like in my arms and my legs especially, start really flaring up when I'm in bed. So I'm tired of all this, honestly. I am so tired of having a health issue after health issue. And it's a very lonely road to go on. It has definitely weeded a lot of people out of my life. There's a lot of people that can't be compassionate because they can't understand, and they think that their pain is universal and your pain is universal, and so everyone has the same pain, and that's not true. So I'm exhausted. Like I said, this has been taxing in more ways than one. And I'm not going to go on a pity party about it, but it's eating away at me. So I will update everyone on I'm having pain go up that tooth that I can't feel, but I can still feel pain in my face. It's pressure and tightness in here right now. The redness is because I'm on my screen porch and it's just warm out here. And I'll continue to ice today. I haven't started eating solid foods yet. Today I will try some scrambled eggs on this side of my face and see how that goes down. I've been doing soft soups and stuff, but I'll let everyone know what I find out tomorrow after I have spoke with the dentist and my doctor's office. I'm in a bind and I need to be able to start my job on Wednesday, and this has me very nervous. I was hoping that the tooth would, after being extracted, bring relief and help bring back my energy levels and help me work. And I live an hour and 15 minutes from Sacramento, and my job is that I drive. I'm a delivery driver to the Bay Area and back, so I need to be able to do that. All right, I'll update later.